Hi, everybody. It's Dr. Dave Fletcher, and I wanted to invite you to this brief introduction and continuing education on heart rate variability and CLA's Pulse Wave Profiler. Very exciting for me to be able to share with you what I've really enjoyed doing in practice for a number of years, and of course being on the stage and presenting what it is that we believe is one of the most important aspects of putting ourselves into the position for discussing the big message of chiropractic, which takes us far beyond the spine and puts us into the realm of human health potential and, of course, the ability to adapt. And so I wanted to start this slide deck as we get into the principles of heart rate variability and pulse wave profiling with a definition. The Collins English Dictionary states that adaptability, is the ability to change your ideas or behavior so that they are suitable for different conditions, a new environment, in order to deal with the new situation successfully. So adaptability really is a human trait that allows us to listen to what's going on in our environment, have the resources to make the necessary changes, and not only adapt to the purpose of surviving, but to thrive with it. And of course, that's the principle under which we really want to participate as chiropractors, and not simply to maintain a person's state of being. It's one of the reasons that I don't really love the idea of maintenance care, is that what we really are focusing on, especially when we start to look at the value of using heart rate variability, is the ability to start taking our clients and patients into the next realm, which is the whole idea of adaptability. And what we're going to see is that we have to really change our thinking away from adaptability into what is known as, or through adaptability into what is known as salutogenesis. And so salutogenesis was a term that was coined by Antonovsky. And Antonovsky really utilized this term to draw a distinction between what was a medical model, which was the associated pathogenic model. And he wanted to put, as we see in the bottom of it, the opposite approach, which describes the factors that support human health and well-being rather than on factors that cause disease. So strategies that enhance the ability of that human in front of us to seed and to succeed. And salutogenesis comes from the term salut, which is the origin of health, or the genesis of health. And here's the most important point, is that it's based upon the principle that salutogenesis is a stress resource-oriented concept, focused on resources used to maintain and improve the movements towards health. And this is very much Bruce Lipton's work, that you can't really live in two worlds at the same time. You can't be fighting in a stress and survival model while at the same time striving to thrive. You have to have the resources, which is your reserve, and you have to be able to access those reserves. This is chiropractic through and through. Chiropractic has always talked about arousing innate, but we have to have the reserves that innate can draw upon to be able to succeed in moving out of perhaps pathogenic states and moving into these wonderful states that we refer to as that well-adjusted state, or the state of well-being, salutogenic. So I put this next one in to remind you that there are three divisions of the nervous system. The central neural processor, linking brain to body, and in a very classic safety pin cycle model. Really, we must remember that even though in heart rate variability we're focusing on a window looking at the totality of the nervous system, the autonomic nervous system functioning, we must remember that the sensory nerves, the motor nerves, and the autonomic nervous system all interplay in leading a person towards that salutogenic state. And so as we focus specifically on the autonomics and the balance of the sympathetic and parasympathetic, and the ability of heart rate variability to look deeper into that principle, what we must always remember, and when I go to do some scan review, is that we're constantly looking at, especially the motor system, interplaying with the autonomic system. This is the key to chiropractic. This is one of the reasons that it's so critical to understand function and feeling together. Feeling being of the sensory nerve so that we can interpret the environment that we're within. Autonomic, looking at the regulatory capacities, the ability for us to adapt to that environmental stress, and looking at the motor nerves so that we can look at the ability of the body to posturalize itself in this gravitational field, move and function in the gravitational field. So let's go back and take a quick look at why we look at the balance between sympathetics and parasympathetics. Parasympathetic is the rest and restore function of our nervous system. We must have it in play, and it is actually, when we take a look at HRV, not so much the interplay of what's going on with the sympathetic overloads as it is the parasympathetic response to the stressors. I'm going to say that again. The parasympathetic interpretation of heart rate variability is the key. When we see that someone is tilted or skewed more to the sympathetic side, it isn't just because they live in a sympathetic dominant lifestyle. In fact, that's a small part of it. It's really that they don't have the strength of the parasympathetic division to modulate that. And so you can see that the rest and restore and physical responses of the parasympathetic division associate with things that are of the emittive way. They stimulate the stomach, the pancreas, the glands to function. They allow constriction or closure of the bronchi, which, as in a comparison to the sympathetics, which is the fight-flight response, is everything is engaged. The person is able to bring in more oxygen. The person is able to beat the heart faster. Their pupils dilate so they can take in more of their environment. The muscles are loaded with blood so that what happens, at least in the peripheral areas, are so they can run away from the stressors. This is what happens, whereas the parasympathetic allows the body to work the glands and the organs in a restorative function and pull the person who is in that sympathetic surge and in that fight-flight response back to a neutral. And that is the principle that you're going to be looking at with heart rate variability, is the ability of the person to look at their stress resources, which is the amount of activity that is, reserves that sit within the autonomic system, and the ability to pull from left to right or right to left, as we look at the graphs, the ability to move the person to a center line so that we can understand the interplay between this sympathetic and parasympathetic side. So when we have a fight-flight response, this is associated with an exogenous stressor that's coming in. We emotionally perceive the environment, we physically perceive the environment, and our brain at the hypothalamus identifies that through a series of logical responses that might be associated, or reflexual responses. But what happens is that the sympathetic nervous system is activated, not only directly through the neurotransmitters, but it activates associated also, as you can see, with the adrenal cortical system by releasing the CRF, and the pituitary gland secretes the ACTH, and the combination of the two with the epinephrines, the norepinephrines, and the ACTH arrive in the bloodstream, and this creates the associated fight-flight response. And something has to modulate this runaway train, and that is going to be the ability of and the integrity of the parasympathetic system to pull itself back again. So this is one of the reasons that we associate with in language to our patients, that they're living many times with their foot on the accelerator, which means they're sympathetic dominant, at least in their response to the stressors, and they have to learn how to put the brake on. And many times what happens that our external stressors, as we'll see on the next slide as well, are a combination of those classic 3 T's that chiropractors always talked about: the thoughts, traumas, and toxins. Another way of talking about that is the idea of emotional thoughts, traumas being physical, toxins being more of the biochemical. And the reality is that what we can teach our patients is that the more that they live in a lifestyle dominant response, emotionally, physically, and biochemically, the more they push themselves into an unbalanced state, the more they drag the parasympathetics down, because they become an exhausted response or they lose their reserve. So you're going to be really learning a lot about how the body has to be able to re-engage its reserve, rebuild its reserve, and stop draining it through the thoughts, traumas, and toxins in our lives. But the other side of it is what can we do as chiropractors to stimulate and engage that? So just a review here how structure and function really associate and how chiropractic really blends the two is that stressors from the outside, physical, chemical, and emotional, are interpreted through our sensory nervous system. And the nervous system then reacts. If it's overloaded, it gets into a fight-flight response. And what happens is that it then causes a posturalization. The body has to pull itself out of the stressful environment, lock itself down into a flex state. We'll talk more about that when we talk about EMG studies. And of course, the muscles then don't simply pull, they affect the joint and bone positioning, and that then is interpreted as one more stressor to the nervous system. And so you can see that this is an endless loop. And I just want to let you know that the vertebral subluxation is really what we're looking at on this slide, is that the neurology of interpreting the environment, interpreting how the body is going to resolve the stressful issue, is then built into a structural response to the muscle and bone. So when we palpate a spine and feel muscle tone issues, we're really looking at an imbalance within the autonomic nervous system as much as we are looking at a structural motor system response. And I want you to remember that. So CLA many years ago decided that what we needed to do as chiropractors was identify the neural interface of what's going on in a subluxation. And so we created the three most important testing protocols in the 21st century's form of chiropractic, which, as you can see on the left, or you may not know this, but you should see on the left, a graph which is what we're going to be talking about today, heart rate variability as it's plotted from our technology. The middle graph is a pattern of EMG, and the far right graph is a thermal scan or a thermography interpretation. And what we are going to teach you to keep this simple and to keep it focused is what we're talking about is an RED interpretation. R standing for reserve, E standing for the electromyography energy that's being spent in posture, and D for the depth, meaning we're going to look at thermography in subsequent sessions, but we're going to look at the depth under which the end organs and glands and the processing of that stress has gone deeper into the health of that patient. So the one we're going to spend our most time on today is reserve or pulse wave profiling. And I'll show you the difference and why we connect pulse wave profiling with reserve. So this is the neuroPULSE, which is a technology that's really quite brilliant. It's actually an autonomic station. It's not simply a way in which we collect heartbeat. You'll notice that there's an attachment of an ear clip that can be used in pediatric settings, adults as well, but pediatric. You'll notice that there are two brass sensors that are sitting on the platform. Those associate with the collection of what's called skin conductance response, or GSR, galvanic skin response. And this is one of the things that makes the technology so unique in CLA, is that it combines the live streaming anxiety testing with a very, very accurate heart rate collection through something called plethysmography. And what you don't know, perhaps, is that it's also modulating or looking at the temperature of the person. So we're really looking at three interpretations of that person's autonomic functioning nervous system all at the same time. And what you see on the left is a graph which plots the heart rate variability of that patient, and probably one of the most readable graphs that you're going to have. And this is specific to a chiropractic population. And I'll bring that up right now. You'll notice that there's a green box, and you'll notice that down into the bottom left, where I'm circling the cursor, you can see a little white dot. This happens to be the plot that was collected in an HRV test. The green box that you'll see here, and in subsequent versions, you'll notice that the green box will actually extend all the way to the top in later versions. The green box represents what we know is a cohort of well-adjusted patients. One of the advantages of using a system like the Pulse Wave Profiler is that in a chiropractic setting, you are comparing apples to apples. And what I mean by that is that you are looking at that patient in front of you compared to a cohort of 2,468 different scans that have been associated with well-adjusted patients. When we scanned well-adjusted patients and we put them on a scatter plot, the vast majority of them fit near the center line, as you can see, and up higher into the areas that are allocated upscale, if you will, from the bottom of the graph. So vertically, we have well-adjusted people being closer to the top, and they must be in balance. On the right-hand side of the graph is the parasympathetic frequencies or loads that we will be checking. And on the left, we see the sympathetic. And so you can see on this person who happens to have a plot in that sort of lower third of the graph we see here on the left-hand side, that person would be sympathetic dominant and low within their reserve. And you'll notice in the top right, above the graph are two scores, which are referred to as Autonomic Activity Index and Autonomic Balance Index. And the Autonomic Balance Index is in reference to the amount of shift to the left or to the right. And so you'll notice that this person, Autonomic Balance Index, scores only 27, so they're operating in the 27th percentile. And then notice that in brackets, it's S to the left side, or sympathetic dominant side. And you'll notice that they are operating only with an autonomic activity index of 48.77. And that means that, and if you look, the green box allows us to go down to the 80 zone, but it sits generally, the green box, between the 80 and 100th percentiles that are in there. And so what we see is that in the average, this person is sitting in the 47 out of what we would consider a low acceptable level of 80. So this person is really in a very stress dominant state that has drained their reserve. But here's the very interesting thing, and we'll teach you more as we go down looking at the graphs. I just want to plant the seed to say, and this was done at dead calm normal. So this person who is being scanned with this graph actually perceives themselves as being in a quiet, comfortable, protected state, which is what the anxiety testing tells us, when in truth their physiology is telling us that they're locked in a fight-flight response that is basically draining their reserve. So again, going back to the analogy of their foot on the gas pedal, this is someone who is at a stop sign, very quiet, in their perceptions, and they're revving their engine. And they're revving their engine so much that they're burning up their reserves and resources. So something to sort of begin by planting these seeds to understand where we're going. So as I said, using a neuroPULSE is the only technology of its kind that simultaneously collects that GSR, which is that anxiety testing with the HRV data. It compares the results to that chiropractic cohort, and we calculate HRV as a percentile. And here's one of the great things, is that the combination of EMG studies and thermal studies along with HRV studies allow you to create a core score, which allows us to look at a tracking mechanism of how that person's neural efficiency overall is managing. So let's get into how we can use a beating heart to understand their stress levels. Well, when a heart beats, it has to have the activity generated from a sympathetic response, which in this case is the R strike. And if I could, I'll just point out this is an R strike, and this is another R strike. So that is one heartbeat between these two. And if you remember, the QRST wave is that what we're looking at is an R strike, then repolarizes, comes back, and then does another R strike. Now, if I was to have you hold your hand on your fingers on your radial pulse, and I said to you very simply, count the number of beats per minute, and arbitrarily we said that there were 60 beats per minute. That would mean 60 beats per 60 seconds, and the RR interval, or the interval between these two spikes, which you see listed here, would be 1.00 seconds in that calculation. And we are led to believe many times that RR interval in a string of heartbeats, as we see, is really consistent. Well, actually, it's not. And this is a normal, healthy 2.5 seconds of heartbeat data. And you can see that by the 3 decimal points, the RR intervals are 0.859, 0.793, 0.726. This is a very healthy response because the body is constantly listening and adapting and using its energy wisely to adapt the beat to the needs of that environment. And so even though that person is seated quietly, their mind is working, their visual cues are bringing in the environment, the body is taking in enormous amounts of data, and that is reflected in this, what I refer to as dancing on the head of a pin, meaning that it's constantly readjusting itself to be as efficient and ready as it can be. And so this level of variability in the heart rate, which is heart rate variability, the variability in the heart rate is a very healthy ability to have, except that it can get a little out of tilt if we start to get too much variability. And this is a pathology state that's known as, we see it in AFib, but we also see it in arrhythmias. And so we know that there is a range of variability that is acceptable. And researchers started to apply what is known as chaos theory, which looks at quantum theory as to how complex systems, utilize and reorganize and cause next level change. And what we start to realize is that a healthy, adaptable system has the right amount of variability with the right amount of reserve to draw upon. And so when we take a look, and this is why it's so important to understand the value of heart rate variability for chiropractors, is that chiropractors directly influence the functioning nervous system when they adjust people's spines. And so what we know is that the parasympathetic feeds for modulating this heart rate come through the vagus nerve. Now, the vagus nerve has a special relationship with chiropractic because of our relationship to the upper cervical region. And so when we're taking a look at how a heartbeat is propagated, we have to remember that there are sympathetic feeds and parasympathetic feeds. Sympathetic feeds come from the T1 through T4 sympathetic chain that then go to the sinoatrial node, which is in the right atrium. That's the body's natural pacemaker. And the parasympathetic feed originates as a 10th cranial nerve, and it's a vagal motor nerve, and it traverses down through the foramen magnum and works its way down into the sinoatrial node. And so at the sinoatrial node, we have the sympathetic feeds, which are allowing epinephrine to be fired into the system. And we also have the parasympathetics, which is allowing acetylcholine to be, as a neurotransmitter, fired into the sinoatrial node. And the demands that cause the amount of neurotransmitter to be firing are directly related to the emotional state, to the trauma state, and to the amount of fight-flight that is occurring within that person's responsiveness. Dead quiet, you get it. And so what we're interested in is the timing and the amount of frequencies. So frequency domains and time domains are what are going to be able to be used to understand how much amplitude the person has to fire and how much firing amplitude they're using and what timing there is between the two. And when we start to apply some mathematical calculations to those two domains, frequency domains and time domains, we get to be able to plot the amount of heart rate variability that a person is operating with. So what we need to do is we need to collect a string of data. And in 1996, the European Heart Pacing Standards, which is a very much pathogenic-based model of looking at heart rate variability, was put together mostly through cardiologists and exercise physiologists. And they came upon the standard at the time in 1996, which was a 5-minute collection with an amount of resting, what we call pre-roll. And originally, CLA adopted those same principles to collect the data that's important for you to measure against. And for many, many years, we operated under a 5-minute collection model. And it's fine to do it, but 5 minutes offers a long string of data, which associates many times with looking for pathology and pathology of beats. Well, as chiropractors looking through a salutogenic model and with the amount of data that we have, we started to look and say, could we use a 3-minute collection? And now CLA is advising that accurate and reliable data can be obtained in a 3-minute collection and only a 10-second pre-roll. So the presets have really allowed us to streamline how much data we need to collect so that we can plot a really wonderful amount of HRV continuation data so that we can get very accurate and reliable heart rate variability plots. I put in here that we built into our system the ability to actually choose a 1- and 2-minute collection. These we choose not to use in a clinical setting, but in a demonstration or health screening setting. They're ideal to show people the connection between the non-spinal test, being chiropractors, many people think that we just work with the spine, but I use this in corporate settings to show that people living in a stress response can definitely be tested and managed through a chiropractic model. So a demonstration of 1 to 2 minutes is available. This is what a string of data over 5 minutes looks like. You'll notice the red line stands, which its IHR stands for instantaneous heart rate graph, and the SCR stands for skin conductance results over time. And what we know is that the IHR and GSR, as the SCR is known as, are live streaming simultaneously. So at the same time that we're getting that person's heart rate, notice that he's plotting somewhere in the mid-60s, pretty much on a very standard smooth line going through. He's taking that in a very calm, responsive way. And so the range of that blue line is what is a physiological range of a person who is at a quieted state. And so what we do when they do collect that is that we recognize that we can split out the electrical activity, if you will, that's firing the heart, both through the sympathetics and parasympathetics, and actually then get an image as to what the different frequencies are. In the low frequency, in the low frequency banding, that's what is known as something that associates with the sympathetic side. And high frequencies are the parasympathetic side. So it doesn't take much calculation to take the amount of low frequency, the amount of high frequencies, and put a ratio together to understand the balance or the left-right split. And what we also can do is we can then, there's also a VLF which is associated with it, but in these length of collections, which are 3 to 5 minutes, VLF does not play a substantial role in the calculations. The mid formula I put in there is something called FFTs, and that's fast Fourier transforms. It's a converting time and space to frequencies. Allows us to use a very standardized protocol to understand how the interplay is working between these two frequencies that are in there, and the time and frequency domains can then be calculated. Very fascinating. And just so you know, this is not a CLA calculation. These are standardized, validated, and related methodologies for calculating HRV that are looked at in all disciplines. So when we do a collection, and I'm going to go back to it, this is what we would like to see. We realize that many times the person's hand within the sensor can move, that the person can have an anxiety moment, which, as you can see with the blue line spiking in here, causes some difficulties. And you can see even in the bottom line that there are 3 breaches above there. Why I put the top one in here was to remind you that even in the quieted state, the person can be quite agitated and their heart rate can be doing quite a bit of this and that. This would not be an acceptable collection. There's too many breaches of the anxiety. We don't know if this person is actually in a quiet state to get good heart rate data. And you can see that in the bottom one, even though they live in a very calm and controlled heart rate, that there are 3 breaches. We sort of arbitrarily, after looking at a lot of data, have arbitrarily said that if there are anywhere from 3 to 5 moderate breaches, sometimes these breaches that you see here on the bottom are quite large, but sometimes you'll get 3 to 5 of these small to moderate ones, unlike the ones above it, which are large and mild to moderate. We will accept this bottom graph as being a good collection rather than redoing it. And we'll go into that just in the next slide. The next slide, again, shows us those tiny little breaches. Those are coming up, and you'll notice I've listed them as good. You'll notice on the red line on the left graph that there's a good ability of the body to hold a maintained collection. Now, you might say, well, wait a minute. And if you were to take a look at the timestamps, you'd actually see that these are very close together. And you'd say, well, wait a minute, these are 2 on the same person taken only moments apart. How could they be off? And what I'd like you to do is just check and see the red lines right here. Notice these gaps that have been put in. Dr. Hansen shared this scan right in here. These gaps actually are caused by the person moving their finger off the sensor. And again, it's one of these great double checks that this system allows us to do is that we can view the graph, and in future software versions, there's going to be alerts that are going to be placed to alert the patient to bring their hand back to a better contact. This one was off for about 8 to 10 seconds, and that's too long because it means it's a flat line on the graph, and you can see that it does change the data collection, and it does change the ability. I would say, and this is just an arbitrary number, but I would say in 90 to 95% of the collections that we do clinically, there are no gaps, and that this is a very stable system. So we're really talking about these outliers, but you now have a way of not only seeing that the patient is in an anxiety state, looking at the GSR graphing, but you can now look at the IHR, which is the red line, and double test to make sure that the collection was fine. This is why the CLA system is so highly regarded in research facilities, because we know we get reliable data. So if the target is the green box, and many people do hit in that as we go down a chiropractic care model, we get to see that the goal is for them to not only get to the green box, but continue to elevate themselves closer to the top of the graph. This is the ability for us to recharge and build healthier responses within the area. So just remember that. I've color-coded the graphs to just give a communication to our patients. Green obviously is the zone we want them to be in. The first yellow, these are not based on anything other than just visuals. They are not research associated. So when I talk about category 1 or category 2, it's just a communication support method, but you'll notice that we can discuss if they happen to fall into the yellow zones, category 1, category 2, or in the sort of reddish zone in there, that would be a category 3. Now you'll notice that it's built in a parabolic shape because it's just as bad in category 3 to be even high up here, but you can see that category 3 takes us literally to either edge of the graph. This means that it is just as bad in a health-related scenario to be as far out of balance as it is to be low, which obviously gives us the greater content there. So the parabola, it really associates much with the health of where the autonomic balance and activity interplay. Many times, and I put this graph in with obviously the arrow pointing to the green box is the desirable state. You've seen this graph already. This is reserve and resiliency. This is the gap that people live in between what they feel and how they function. And you need to understand that this person who plots down here having very low resiliency is very vulnerable. Very vulnerable because they are in the belief system that they're at a physiological quiet state. They may emotionally know that there's a lot going on, but you must remember that clinically, when somebody plots far to the left and downscale especially, this is their autonomic regulation, which is locked into a sympathetic state. And it also relates to the idea that they have a very low recovery and resting model, meaning that there isn't enough parasympathetic tone within their nervous system to pull them back to center. Well, what that means is that the next could be minor stressor that is going to come into that person's life could be that one which drives them further or creates a physiological reaction. Now, what are some of the physiological reactions that are associated with left-sided shift as well as low left-sided shift? Well, pro-inflammatory. This person has a much more hair trigger, if you will, in the inflammatory responses, which means that they won't recover as quickly from activities which cause some joint reactions. They could have an episode of, spinal mechanical difficulties, and they go to lift something. They would blow up and inflame much faster than somebody who is in the green box. We certainly know that a lowered immune response is associated with a shift to the sympathetic side, and in this case, a lowering shift on the sympathetic side. These are the two critical issues that we take a look in a pathogenic state. Inflammatory response, lowered immune response. This means that, in glamorously, I refer to them as a wounded gazelle on the Serengeti. It means that the external stressors are going to get them faster than anyone else. Here's the great news. Remember, we looked at the green box of well-adjusted. When people are under chiropractic care, they move closer to the green box. It means that they become less vulnerable and more resilient. And I wanted to share with you at this moment the fact that in a normative database, which in this case is chiropractic normative database, we're able to plot where the well-adjusted people are. In a public database, you need to understand that the public database actually plots the green box if we were to plot it down much lower in the yellow zone here. So by the nature of people being well adjusted, they not only have a greater resiliency than the general public, but they have a much less vulnerability just by being well adjusted. So it's a hugely exciting technology to take the word and the message away from the spine only. This moves the conversation so far away from bone out, pinches, nerve causes problem to where we are in talking about the neurology and the nerve systems, getting the person to an adaptive state and keeping them there and improving. And here's one of the great things. You literally are watching a nervous system learn how to cope and how to optimize when you work in sequential HRV scans. So we worked with Bill Esteb in the early days to try and help people have a better understanding. If you take a look over here, you could literally draw this and draw a horizontal line somewhere, you know, at about where the bottom arrow is, and you could divide this this graph into 4 quadrants. So this is what we refer to as the 4-quadrant interpretation, or at least communication. And we know that somebody who is in the upper left quadrant, in this zone up in to the left of this, really has quite a bit of reserve, but they many times feel as if they're sympathetically dominant, so they feel uptight. And these are people who perhaps are overworking in the gym. You know, these are people who have a lot of high responses. They're well adjusted many times in their lifestyles, but they have that time, or they live in that time where they constantly are overloading themselves. These are people that I always refer to them as the CrossFitters. With great intention, they go out there to take, use exercise, for instance, to try and put them in a healthier state. But in a sense, many times they're exhausting the reserves to get there. And so one of the things that you must hear, and I hope you hear this very clearly, is that heart rate variability is a lagging indicator. It's a slow to move response. Don't get me wrong, it can change right after an immediate response after a person is adjusted, or as we see with exercise, it can shift, but it will go back to its set point after the physiology has calmed down. So when we go to take a sequence of scans, we're really interested in not seeing that patient's, in our system, that patient's athletic response and the recovery from an athletic event. Although we can do that, we're really mostly encouraged to look at is in a care plan, is the person with the use of a chiropractic adjustive model and lifestyle modifications able to move closer to the middle and balance them up towards the green box and higher. So when a person is in that upper left quadrant, many times they're just really overstressing themselves. But here's what you need to know. Is like their foot on the gas pedal. If they keep pushing in that zone, they're going to drop the amount of reserve they have, and they can go from uptight into distressed. And the reality is that the distress mode is where probably in that left high and mid and lowering zone, where 80% of your patients are going to be. The majority of them are going to be living over into that zone. The top right really is an interesting response, because much like we talked about the top left as not only being a sympathetic response, but an inability of the body to recover quickly, if they go and lock into the upper right quadrant, it typically means that they have a very low or sluggish response where they're not even able to pull forward to the demands of stress in that environment. And many times we talk about this as driving with the parking brake on. And so just imagine that they have a sluggish response, and this many times comes because they have exhausted their adrenal responsiveness. You'll remember when we talked in the earliest stages that I talked about how the hormonal responses associated with fight-flight. And so many times we're going to see people that have adrenal exhaustion or physiological exhaustion plot down in that bottom right quadrant. And it's our assertion that people will kind of drift from the left side to the right side as their body goes through these adaptive changes. But what we know is that when we keep locked in from scan 1 to scan 2 in that top right area, we typically see people that are physiologically very worn down, adrenally, etc. And these are people who exhibit a lot of the physical nature of allergies, who are exhausted in the way they engage the world. They can't meet the demands of even the slightest needs of the fight-flight. They can't respond because they don't have what it takes. And these are people that many times, especially in the upper zone, feel that they can't really get their life on track. Many times you're looking at emotional exhaustion that's driving them into that state as well. The bottom right tends to be people we don't see very often. And the reason is they tend to be medical or pathogenically related. Weakened many times drives down to dormant. It means they have a very low amount of reserve within their system, and they are very, very much on the low ebb responsiveness. They can't get their sympathetics to even engage to the stress level. So these people many times end up into a very low zone. And as I said, they tend to be on the more medical. You're going to see the vast majority of your clients posting and plotting in the top left and bottom left regions. Those are your common plots in a chiropractic practice. So when a person has low heart rate variability, these are published responses. They have decreased adaptability. We've talked about that. Increased mortality risk. They're vulnerable. Increased risk for arrhythmic events. Remember, this is a cardiac testing device, so we have to see that. And depressed patients with coronary artery disease. Comes as no surprise. So I want to go through the next 3 or 4 slides to show you in some of the earliest ways in which chiropractors studied HRV was John Zhang at Logan College. He's an MD, PhD, but he took it upon himself to look at the chiropractic relationship to HRV in 3 separate settings. And so he went to 96 DCs, 625 patients. They did a single visit, both pre and post, just one visit, pre and post. And they noticed that the heart rate decreased. In other words, they influenced their relationship in the autonomic processing. They noticed that both the high frequency and low frequency both increased, which means that they were able to engage both with one adjustment, both the sympathetic and parasympathetic feeds, and that the total power increased, meaning that they were able to boost the activity within the system, and that at the same time, if they were about to do that, pain analyzed by VAS decreased. So everything pointed to the value using HRV of looking at a one-visit model that said, you know what? When you adjust a person's spine, you kickstart their entire autonomic system. Now that comes as no surprise to us as chiropractors, but in an academic setting and in a corpus of knowledge and research, this is big, big news. So they then took the same 96 DCs and they took 132 patients over a 4-week period. And they started to notice that, well, the heart rate, and this is the lagging indicator, didn't really change significantly, but watch this. The LF, meaning the sympathetic dominant side, changed significantly, while the HF did not. So they were able to re-engage the sympathetics as a first layer, which isn't that uncommon. They took their foot off the gas pedal, but they didn't re-engage the HF side so that it started to say this was a lasting response. And the great news is that once again, well-adjusted people showed that the activity or the total power increased. Then they took 27 first-year chiropractic students with 4 measurements over a 12-year period, 12-month period, pardon me, not 12-year. They belong past their students' rate. And they looked at their heart rate decreasing and increased, finally, parasympathetic activity, which means that over the course of time, from whether it was that 1 month to those 12 months, there was a definitive not only balancing, and there was always an increase in the total power, but now the parasympathetic activity was starting to increase. And he was able to publish that the decreased heart rate, which was general, and the increase, this is standard deviation, normal to normal, SDNN, which is the way I was showing you the calculations, as well as the total power from HRV analysis indicates that chiropractic treatment, I don't like the word, is associated with a shift to a healthy autonomic nervous system balance. How do you like that? And so that was one of the first things that was published way back in 2005. And since that time, there has been a tremendous amount of information that's being shared in an academic models looking at heart rate variability. And I'm going to be very bold to tell you that heart rate variability at the chiropractic college level, and we're deeply involved with it at 4 different colleges, allow us to say this, is that this is the cutting edge technology, not only in the research model, but to confirm everything we've always talked about, is that although you can have a spine to nervous system relationship, it's the impact that you have in the totality of the autonomic nervous system to be more adaptive that places that person in a salutogenic state. And in doing so, that means that you have accomplished what no other healthcare providership sets out to do, and that is what we say is to arouse the innate capacity of that person to manage themselves by identifying subluxations within their spinal neurodural core that affect their totality of neurofunctional status. So this was interesting with Yuri Gudron. He was one of the leads on this. I had a chance to sit and discuss this paper with him in person. But what's fascinating is that heart rate variability is being used across the board in so many different ways. But here you have a cancer specialist and a physiologist who's looking that if you have an active vagus nerve, cancer stage may no longer be important. Vagal nerve activity independently predicts prognosis in cancer. So traditionally in cancer rating 1 through 4, they're looking at the size of the tumor and then grading it as it relates to the progression as it goes forward. And what they're saying in this paper is that a far better way in which they can determine the prognosis of the patient is not to measure the size of the tumor or even the progression as they look at in a pathogenic state, but to use HRV to identify, are they in an adaptive state? Can they take more care? Can they take more interventions? Are they ready for that? And of course, this is where the fascinating interplay comes between salutogenesis and pathogenesis, which means that as we build a better and stronger foundation for our patients, it means that if they should need, let's in this case say cancer care models or any other medical interventions, they're more prepared to have the best response. So very, very much interest in there. I'm going to show you, this is a client of ours who sent a much more detailed than what I'm going to be showing you case study. This is Michelle Fox, and I brought this one forward as a case study as we enter into the case study portion of this conversation to show you that this is a very high, this is a female who has a very, very high heart rate. You'll notice that it jumps up to the 120 beats per minute. In fractions there, but it sits primarily between 95 to 105. That's high. And in females, typically a stress response in females is a continuing stress response is going to show up in heart rate, whereas men it's going to show up in blood pressure. You'll notice that this heart rate is being propagated by somebody who is at rest. And so this is their resting heart rate, and it's quite high. And what you'll notice is that this person plots dead center on the line. I don't know if you can see it. This is the little blip that you see just right at the 70 mark, if you will, and associates with this 99.65 balance. They do come to balance. And I will tell you this, is that you may be sitting here thinking, well, it would be a little better if they had more parasympathetic than sympathetic. No, you're wrong. We want to find that balance trumps everything. So this is an ideal balanced one. And this is a patient with that high dominant stress response is draining their reserve, but has the resources, even though they have a high heart rate, to keep themselves in that state. A second test, again, this is after a series of visits. You can see that the heart rate really hasn't changed much, maybe down a fraction. I can look at the graphs, but just looking at the visuals, you can see it was collected at a dead quiet. And after 12 visits, similar plot, as you can see, a little bit at that same 70 zone. Why did I put this in? Well, what you don't know is that this person, when they were adjusted, had a thermal scan. We're going to go into that a little bit more. Had a thermal scan that was absolutely one-sided as they entered, completely dominant. And after 12 visits, the thermal was clear. But as you can see, the HRV really did not move at all in terms of its plot points, both center line and its activity. And so what I want to do to introduce this to you is start to show you that you can have a tremendous amount of change occurring in the motor system and in the regional autonomics, which is what we're looking at with EMG and thermal scans. but you many times will not see the results that you think you're going to get in the heart rate variability testing. Why? Because it's a lagging indicator. It's a long-term set point of how the totality of life stresses has worn out the adaptive response. And so many times, and I put this forward, this was by a doctor who posted this on our INSIGHT forum. And in future, I'm going to be doing not such a long one like this, but going through case studies, and we'll be posting, presentations like this. But you can see that if you follow the upper left graph, and you can see in the upper left graph the black tracking lines on both the right and left-hand side of the patient, that you'll notice that there's quite a bit of activity in the CT junction on the right-hand side, CT junction left-hand side, flatlining in the lumbar thoracic region. The pattern graph for the EMG on scan 2, which is upper right, shows quite a bit of improvement in that lower right CT region, but quite a bit of inactivity, if you will, as that person is adjusted. This is somebody who's really having a very, very slow and methodical response. Interestingly, the client of ours indicates that the patient feels much better, but again, we're looking at function versus feeling. And I put this chart in here, and we'll go into the HRV reads in just a moment, but I put this chart in here because I think that many times, both from a patient's perspective and from a clinician's perspective, there's this idea that once they lay on the table, it's unicorns and roses thereafter. Is that thank goodness that the chiropractic is in their life, and it's going to wash away all the traumas that they've accumulated over 50 years. And of course, it's amazing that it does what it does. But this is the whole notion of entering into a relationship with a person's spine, nervous system that goes beyond the simple how do you feel, but more to how do you function. And so in a conversation like this, we're really happy to report that the patient feels better. But we also remind ourselves that when we engage a patient in a scanning protocol, that we are dedicated to look at a 3-scan model. Is that we are dedicated to look, as you see in this top left, top and left-hand side, is a scan 1 or a baseline scan. And what you're looking at is a progress scan, which are the EMG and the HRV that's sitting here on the right-hand side of your screen. When we start to adjust people, we unlock a tremendous amount of change that has been pent up within the nervous system. If anything, we're another stressor to the system, and we many times see that the patient feels better, but we have re-engaged many times a blunted nervous system. And it means it has to work harder to do what it was used to doing in that very inefficient but new normal as it was. And as a result of that, many times we see a re-engagement of the nervous system in both the motor side as well as in the sympathetic and autonomic sides. Now, it's very interesting if we take a look at the EMGs here from left side to right side, that we would expect many times more activity as that person is re-engaged from scan 1 to scan 2. And in this case, that person actually went even more into a resilient dormant state in their motor system. And at the same time, the stressors seem to be dropping them down. Well, what does this mean? Wait a minute, we're going to go to the next slide, and we're going to take a look at the thermals, which we had the doctor then post with us. And we can start to see that the first one is the initial scan is on the bottom, and the repeat scan or the progress scan is on the top. Well, you can see that the person has a terrific upper cervical deepened response even after a series of adjustments. They're much better at their deep neural processors, but they still have a very dramatic subluxated model in the upper left cervical spine. And so regardless of what we see in many times our motor system and our overall set points, we need to remind ourselves that healing is a time and opportunity process. So this brings back the whole idea of where we go with our what we call RED. And RED means that what we're constantly doing is thinking about chiropractic and looking at reporting chiropractic through reserve, exhaustion or energy expenditure, and the depth under which the body is able to change. Now, many times we see the interplay that we start adjusting a patient, and all of a sudden their reserve starts to come back if they have a degree of resiliency. Their energy starts to reignite. So many times they lose a little bit of ground on the scoring system of the EMG. And, well, you haven't quite got to the D side. This patient is exactly the opposite. Here we go with a person who is adjusted. We start to get right into those deep processors. We start to then come back and see that their motor system, yeah, it's better in the C-spine as it comes through, but we start to see that all of this is draining whatever reserve that patient had. And this is not meaning that you're doing anything wrong. It means you're early in the stage of recovery and care. And we have to really remember that healing at a neurofunctional level is a time and repetition, neuroplastic responsiveness. Now, I haven't tracked this patient further and forward with the clinician who sent this, but I can probably predict that since they're starting to show changeability and we identify that much of the trending is going on, that given over the course of anywhere from a 12-week to 12-month window of care, as more scans come into this progression, we're going to see that this, and this is what Zhang said, is that their SDNN starts to show greater balance and greater activity, which means that they move closer to the green box. Very exciting to see that. So I sort of put a tough one in at the very beginning here, mostly to try and tell you that it isn't all roses and unicorns. It's all about having the strength of conviction, of certainty, that as you adjust somebody, you are getting into their deepest processors, which in this case are their autonomic controls. And over time, their adaptability and salutogenic response is going to be, where you want it to be. I put this one in, again, on this sort of, I'm not trying to be negative, I'm trying to show you the difficult ones, because the easy ones are easy. So here's somebody, if we take a look, bottom is our initial scan, our middle scan is the progress, and our upper one is the comparative, if you will. And so if we take a look at the heart rate variability testing, it's that low left category 2, almost reaching into category 3 on the bottom line. And you can start to see that associated with that is the E, which is to the right-hand side, is that the person is really, struggling in a way to keep that forward head carriage engaged. You can see bilateral red activity in the C-spine. They tend to brace or protect themselves in their LS junction. They're loaded with stressors that are associated with that. And their upper cervical spine is hot as a cracker over there. You start to see that there's a lot of deepening. So RED, do they have a lot of reserve? No. Are they wasting energy and exhausting? Yes. Not so badly, but we see worse, but yes. Are they having deepening responses within their neural processor? Yes. Scan 2. Wow. They're accepting the adjustments. In other words, this is, look at the reserve. Boom, center line, moving upscale. You see that happening. Look at the energy starting to consolidate. It's coming out of the system. Okay, so now we're re-engaging and we're starting to see that blocked pattern in the upper left cervical spine and the right cervical spine not changing. We're not getting to the deeper spots. Scan 3, uh-oh. We're not getting that subluxation in the upper cervical, as you see in the top left, re-engaged. The changeability that we saw from scan 1 to scan 2 isn't there because there isn't the stability in the neural processors. We're now overworking the system and exhausting it. This is where the conversation has to be with the patient to say, we know you're changeable, but we don't have the stability in your system. So we need to start to look at either a different adjustive model, a different care model of what they're going to do to leave the office and manage themselves on a home-based model much differently. But this is where you have to then use a scan sequence like this to understand the depth and stability of that person in front of them. So not meaning to sound negative, but these are the ones that come to us. And if you were just to look at the first one and the second one, you'd think, yes, I've got it under control. I've won this game. But here we are. We go to scan 3 and we go, you know what? Changeability, the trend is still there in that upper cervical spine. The changeability is not stable yet. Okay, let's set up an ongoing care plan for this person to look at getting their function back to where we need them to be. So fascinating. So what do we do with them? Well, you'll notice I pulled this from the well-aligned group of products. We have a a relationship with them. Insight Media works with them to try and put together report folders for you to use. That's at Well Aligned Products. But I snapped this off of their website just so that I could build a conversation with you. Well, what do we do if we see that their HRVs aren't doing what we want them to? And the answer is that we get them to not only continue their chiropractic care, but start to understand the relationship that they have to have with their health, which means that they have to start looking at those 3 T's: thoughts, traumas, and toxins. My experience of looking especially with people that get locked into these difficult scenarios are that it's many times the emotional components that are pulling them back down. We're not psychologists, nor are we intended to be, but we are trusted advisors, and we can alert people to say, you don't understand how important it is perhaps to find the time to rest and recover, find the time to re-engage in a mental relaxation process, whether it's yoga or whether it's associated with some type of meditation. These have all been proven to raise the HRV and make it more stable. So in this one, get checked is the same equivalent of getting adjusted or being on a regular care plan. Move often. I can't begin to tell you how important it is in our care modeling, even in HRV, to have a system. You know, the word emotion is partly motion, is to physically be mobile, to manage ourselves. Obviously, the happiness is finding ways to address the stressors that occur in your life, and finally eat clean, meaning to really put the apex of everything together and put yourselves in those positions. So I've you know, we can go on forever, and we probably will do that in shorter versions, but this is a good starting introductory model. This gives us a chance to talk about what it's like to use HRV within your office and to really begin to have a confidence that you're using a non-spinal test, showing the balance and capacity within the autonomic nervous system. So HRV collected via the Pulse Wave Profiler is a reliable and necessary window into the adaptability and stability, as I showed you, of a patient's overall health. And when you combine HRV with other INSIGHT tests, the efficiencies of the functional nervous system can then be recorded while under chiropractic care while the subluxations are managed. Let's be clear with this. When we enter into a salutogenic state, the goal is to track that patient's response to our care and to give them trusted advice to stay on a care plan and to use all their efforts to raise their reserve so that they have the ability to take on more stressors in their life, to learn more, to love more, to do everything that a healthy life is all about. When we place our hands on a patient's spine, it's not to move a bone, it's to awaken the energy within their central neural processor. Why? Because the intelligence of the body can then be more active to reorganize itself to its highest functioning levels. So if we can look at EMG studies and look at thermal studies, but combine them with the HRV studies, we have a complete, what we set out to do many, many years ago, new version of the subluxation station. It means that we take a look at the subluxation through the neurofunctional efficiencies as we can record them. And the purpose of today is to show you that probably the greatest advancement in terms of identifying the subluxation process and how far a patient has drained their reserve to recover is by using heart rate variability. The exciting next step is to sit down and recognize that we are in control of looking at graphs to understand that we have the skill to get our patients back into the green box, and for most importantly to understand that the choices that they make directly impact how an HRV is going to show up in their life. As an addendum, I just want to mention what Dr. Matt McCoy and many of my mentors have talked about, and it comes up quite actively as we close out this session, about the impact of drugs and medications on heart rate variability. The answer is they do affect it. If a person is sick and out of control and they have dysregulation going on, many times the use of medications brings them back to a more stable state. And in some ways, that's a good thing because they were so unstable they needed to go into that pathogenic management model. In most cases, what I want to share with you, that people who come into chiropractic are not necessarily stable at all. They're out of control, not only in their feeling, but in their function. They plot on the down left side. And even when we begin to give them adjustments, and even when they begin to feel better, and it's many times, you know, almost as if chiropractic was that substitute for many of the other over-the-counter medications, we can have a conversation with them to say, good for you. We couldn't be happier. You're feeling better. Now we have a chance to look at how you can live your life functionally and how you can protect yourself through a non-pathogenic or non-medical model. It's called chiropractic. And chiropractic arouses your body's natural ability to communicate effectively within itself so that you can begin to take on more life, so you can tend to strengthen what you have within you and control your health without having to rely on drugs or surgery. So I just wanted to mention that. So often patients paint over the rust, if you will, with many things. And the heart rate variability is one of the absolute great honest tests that tells us if they've been painting over the rust for a very long time. So with that in mind, I want to just share with you that it's always my pleasure to talk about all things scanning and all things chiropractic. My name is Dr. David Fletcher. I've loved having a chance to work with you. Please share the message about using the INSIGHT with your friends, colleagues. We are dedicated to this movement, which is a nerve-first movement that's associated with developing best practice clinical strategies based upon the principles of subluxation. Be well.